station. This is Bobo FM.
The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Do you have a healthcare question but not sure who to ask? Contact HSA's Patient Call Center to speak to one of our experienced clinical team members. We are here to answer your questions and help guide you through your healthcare journey. Need to make an appointment? Our team can help. Contact HSA at 949-8600 or email info@hsa.ky. At HSA, we are committed to caring for you.
All right, welcome to the show. We are Bobo 103.1 FM, and each and every week we do a very special show here on Bobo, which is dedicated all things to HSA. I've had a lot of these individuals that's on the show right now, so they're no stranger to the airwaves. They're pretty much professionals, so they're going to be referred to as my co-hosts today. I'm still going to have them introduce themselves, and they know the routine, talk about just in case we have new listenership, just talk about the years they've been employed with HSA and what they do in their respective departments. So we'll start, obviously, with females first because there's one gentleman here amongst two females. So he's going to have to pass it on to each of them to introduce their self first. And then we'll move on to him, who's no stranger, by the way, to the airways. But let's get started. Anybody that wants to introduce himself first, the years that you've been working with HSA and your specialty.
Hi, good morning.
Good morning.
Thank you so much for having us today. My name is Sheree Banks Bailey. I have been employed with the HSA for over 7 years, and I am the team lead pharmacist.
Love it.
Hi, good morning. Thanks for having us, Dane. I'm Joanna Rose Wright, Senior Nursing Officer for Public Health and Primary Healthcare Services. I've been at the HSA and Public Health for over 18 years, and I love community health, and that's my specialty area.
Joanna, you don't talk much, do you? You try to stay away from public speaking. Why do they keep doing this to you? Why do they keep sending you?
I just don't know,
I thought you volunteered to be here.
No.
We love it, though. We always warm her up. She's going to be good before the show even ends. All right, so the one young man that decided to come to this interview amongst two powerful women. Who's the brave man that we have here today?
Good day, Dane. Good day to all the listeners. David Jace Wilson. I am the Deputy EMS Manager for the Health Services Authority, EMS Services, and I have been employed with the HSA for 20 years.
20 years. Before that, you said you were a fireman, right?
Yeah.
I remember that. I remember because I don't know why that sticked out so much to me because I was like, yo,
that was the first love. First love.
It was your first love.
First love, yeah.
But then obviously you saw it out in the field and you're like, yo, let me try that.
Yeah, man, let me try EMS,
And they grabbed you for 20 years.
Yeah.
Love it.
Yeah, man.
Love it. Now, guys, I love doing these interviews only because we find out so much about HSA. A lot of the things that people really do not realize is happening at this hospital. It's building to be it's growing to be one of the most powerful hospitals in the Caribbean, and I dare to even say the world. Every time I interview you guys, you can compare yourself to state-of-the-art facility across the world and what they're doing compared to what you guys are doing. And a lot of times I find that we're just simply doing it better, right? But today we're here to talk about something that's very important. It's a very important topic. It's hurricane preparedness, all right? So with hurricane season here, not around the corner anymore, it is here. And we're learning that every single day with storms popping up in different areas of the Caribbean and sometimes next to different areas like Mexico recently had their first hurricane, and we have storms coming in and around the area of the island. We want to also know, how can we prepare you from a health service perspective? Because that's very important. You probably are living at home and you take medication, you need special assistance. You need to know, how do you act? How do you prepare if there was, unfortunately, an emergency like a hurricane to approach our island or threaten our islands at any of these times? So I think the first question I'm going to ask, guys, and I do believe it's for everyone or anyone that wants to take it, is what is HSA role during hurricane or during our hurricane?
So, Dean, that's a good question. So the HSA's role during a hurricane, we have to kind of change that, right? So we have a role before, during, and after. But the primary role is to provide urgent medical care and attention after the passage of a storm. Sometimes individuals may think that the HSA or the hospital is a shelter. Unfortunately, it's not. Reason for that, we have to prepare in the event of after a passing storm. If there are significant injuries, we have to ensure that we have adequate bed capacity, adequate capacity in general, just so that we're able to treat and care for persons who might have been injured or even worse, right? So we're only going to allow persons who require active medical care or attention. So persons who might have come in before a storm, they might have had like a medical procedure done and they need to stay there for follow-up care and attention.
Yeah.
Those are going to be the only persons that are going to remain in the hospital facility itself. And then afterwards, again, when the all clear is given, we'll be able to provide care and attention to pretty much all persons within our islands.
Okay, that's good. So I think you pretty much answered the question. But if anybody's obviously at the hospital at the time, unfortunately, because you may have had a minor surgery or maybe you're just not feeling well, are you saying that those individuals are allowed to stay at the hospital?
Those individuals are allowed. And again, that will be in consultation with your physician. So whomever might have done the procedure, they might say, hey, listen, this is something that we're considering for you to stay in the hospital facility just because we want you to be under direct care and supervision of a medical professional. Whereas if it's something similar, a quick in and out procedure, they might say, listen, these are your regular medicines. We're going to provide you with some pamphlet information, some guidance, just continue to monitor it. And then if anything, after the all clear is given, then you can come back in just for a quick follow-up.
Why do you think guys look at you guys as a shelter? Does this happen a lot of the times during hurricanes? People usually come there and they're like, well, let me take refuge here. Yeah. Does that happen often?
So believe it or not, I mean, I know Nurse Joanna can speak more to this, but I remember, funny enough, during Hurricane Ivan, I was still at the fire service, right? So I literally just left after Hurricane Ivan. And I remember us hearing calls on the radio when we did have radio communication that literally persons were seeking shelter at the hospital.
Wow.
It's a place of safety. So when you think about it, right? People come there. They feel safe because we have nurses, we have doctors, we have other medical professionals there. So people would look at it as a place of shelter, as a place of safety, so to speak.
Yeah, absolutely. That definitely makes sense. And also, it's if you want to be safe during a storm, and you would think that facility was built to withstand a storm. So people are going to go wherever they feel like, hey, nothing's going to happen here, right?
Yeah.
All right, so guys, let's talk about your emergency medical centers. Where are they located?
Okay, so while HSA is not a designated shelter, we have other shelters on the island that are safe, and we encourage persons to go to those shelters. Among those shelters are emergency medical centers, and these are designated buildings which are inspected, and they are okay for persons to be there during the hurricane. It's usually schools or civic centers. And there are several on the islands, on the 3 islands, and I'll give the names maybe later on. But these are designated for persons who would fit the criteria to go to the emergency medical centers. And there are 2 main reasons for these centers. First, they are there and equipped with staff and supplies in the event that there are emergency or urgent situations, then we are able to attend to those. And also, after the hurricane, we have adequate supplies at those shelters in the event that the roads become impassable and persons are not able to go home. Then we can take care of minor injuries there even after the hurricane.
And then that's very good. Thank you so much for breaking that down. But we refer to it shortly as, of course, the EMCs, but it's an emergency medical center. Yes. Like, who are we're telling, like, okay, for the person that's listening right now, who are we saying, because we did talk about you may need special attention. You probably go to the doctor on a weekly basis. You probably go and get checked up because of special needs. Who are we saying should show up to these emergency centers?
So these centers are set up or organized mainly for medical vulnerable persons. For example, persons who are dependent on oxygen or ventilators, persons with non-communicable chronic diseases like asthmatic, diabetes, hypertension, persons who are wheelchair bound or have mobility limitations, and also persons who have mental health issues, but they are controlled on medication. Pregnant women at the latter stage of pregnancy, like 36 weeks plus, these persons are encouraged to go to those shelters.
Love it. And how do you register in order to
Well, generally, these persons, if they would like to go to those shelters, generally they can. However, we have some persons who are homebound or limited to wheelchair, and these persons are on our home care list across the island. So they would communicate with the staff at all the health district clinics. And so we have a list of all of these persons. If you have not given us your name, you can also reach out to any of the clinics nearest to you. And these names are communicated to the EMS team, and then those persons would be transported to the shelter if they need to be transported.
Love it. Now, Mr. Wilson, the last time you were on the show, a lot of people really enjoyed your segment with talking about, obviously, your job and what you do on a daily basis.
Yeah.
And really, we got a lot of good response on that. But one of the things, I think I was at the supermarket, was so random. I think the guy recognized me and was like, did you do the interview with, of course, the two young fellas that came on? They were talking about EMT. And I said, yeah. And they said, really loved the interview. I was a little taken back when he said that the emergency services does not come out during an active storm to help anybody that goes through any of these things that she mentioned.
Yeah.
And, I said to him the same thing. I said, look, when he first said it on the radio, I was taken back too.
Mm-hmm.
But let's be realistic. Like, I had to explain to him in aisle 9 that if there was an active storm, how do they really help you when the storm is done? Like, if they're putting their life at risk and we have no EMT to come out there and help you after, then they have to make hard decisions like this to help the masses, right? Not saying that you're not important, but obviously this is why we're having these interviews now. It kind of flows together because we're saying plan.
Mm-hmm.
You have to plan. If you know that you have a special need, and I think that's the same thing that you're going to echo.
Yeah.
Like, this is important for you to look after your health.
Yeah, correct. That's one of the things that has been the message, literally, not just this year, not just this hurricane season, but for the past several hurricane seasons, is for individuals to have a personal plan, have a family plan, and if you're working for a particular organization, have an organizational plan. What are you going to do in the event of some type of an emergency? I know we're speaking in particular to hurricanes at the moment, but let's just go back to our memory for those who can recollect back to Hurricane Ivan.
Yeah.
We had persons' roofs that were literally just peeling off. Pieces of zinc were flying through the air. And just imagine that impacting someone going at 100 miles an hour. So we not only are thinking about our safety, but we're also thinking about the safety of potential persons, our patients that we have to go to collect in the community. It's definitely not a safe situation. So when we start to experience tropical storm force winds that are sustained, unfortunately, no emergency service, whether it's police, fire, EMS, and even our regiment, no one is going to be responding at that time just because of safety.
Yeah, I'll tell you a story. I used to be the marketing manager at Flow.
Okay.
And I remember, I cannot make this up. I cannot make this up, guys. I remember we were getting an overwhelming amount of calls during an active storm, and people were saying that their TV was down.
Yeah.
And when can we send a technician to come in and fix the television? You cannot make this up.
Yeah.
Like, this is real. When I say this, folks, there are people, maybe I'm talking to you. Maybe you're one of those individuals that would do this. And I'm glad that we got to reestablish this again, because, guys, we can't. There is no possible way during an active storm. Their lives are important too. We can't send EMT out there to go and save people because they have to save a lot more when that storm is done. Hopefully that doesn't happen, but we got to think about those, because Ivan, I am still to this day very surprised that we did not lose any lives.
Yeah.
It was thinking about it gives me goosebumps, and it brings anxiety. And I think with the last storm that came last year, I found out how many people were still on the edge because of Ivan.
Correct. Yeah.
So yes, I'm glad that you guys are having this conversation. We're going to take a short commercial break. And when we come back, we'll find out more about the emergency centers, where they're located, and what do you bring, how long will they operate for, and so on, so on. Keep it locked. We are Bobo 103.1.
The Health Services Authority has over 120 world-class physicians offering the most comprehensive range of specialist services on island. Our dedicated team of professionals provide the highest quality care in orthopedics, interventional radiology, women's health, geriatrics, and a host of other specialist areas. We are a JCI accredited organization with a proven record of excellence. At HSA, we are committed to caring for you. For more information, visit hsa.ky.
All right, welcome to the show. It's 103.1. Of course, Bobo, thank you so much for tuning in. Of course, a show dedicated on a weekly basis to HSA. We are talking about hurricane preparedness, and we're going to have our guests introduce themselves. Just again, really quick for a new listening public. All right, so we'll start with females first, maybe in the same order that we did before. Just so there's no confusion. Go ahead.
Thank you again, Sheree Banks Bailey, pharmacist, team lead at HSA.
Love it.
Joanna Rose Wright, Senior Nursing Officer, Public Health and Primary Healthcare Services.
And good day, all. David Jace Wilson, Deputy EMS Manager for the Emergency Medical Services, the Health Services Authority.
All right, so we're talking all things hurricane preparedness here, guys, and I want to thank you for coming on and having this important topic. We are in the middle of hurricane season right now. Usually becomes very active around the September time. That's when we see a lot of the, what is it referred to again? The storms that are, oh my goodness, why am I losing this in my mind right now? Obviously, the Category 5 storm, major hurricanes is when usually come around the September time, right? But anything is possible. I like to say that we are seeing climate change every single year, and things are just happening that is unspeakable. So we want to make sure that we are always prepared, and having you guys on is a very important topic that we love to have discussions on. What I want to ask you guys is, were you guys here for Ivan, and where were you if you were, and what was your experience during that time? Any takeaway stories? I like to give these ones just to make sure people are prepared, because it was one of those things that when I give a story around it, a lot of people still can't believe that this storm took this island the way that it did. So yeah, let's start with you. I know you were
well, I'm just looking to my colleagues here, and apparently they weren't here for Ivan.
They weren't. You guys weren't here?
All right.
Oh wow. Okay.
So yeah, I guess it's me.
Yeah.
So as we spoke about, so was in the fire department and literally watched everything unfold, literally from Central Fire Station, and to just experience that, it really brought a new perspective of life, and how we should take care of each other, be kind, be gentle to one another, because literally we're looking outside at the back of the fire station. I never forget this. The former chief at the time, he literally said, we all have to be here for each other.
Yeah.
We're looking at, some of the planes are on the back of the runway, just kind of, tumbling end over end. We saw some containers that were flipping on the runway itself.
Wow.
So you can just imagine the sheer, fear in us, thinking about what we're seeing literally at the back of the fire station, maybe the front of the fire station, and then what is potentially happening in the community, right? So it was a lot. I'm not going to lie. It was a lot.
You see planes tumbling over. Do you think, like, what was going through your head in that moment? Because if I've seen planes turn over, like, we've seen a lot of storms pass through Cayman over the years. And we've always, I think, what was different for us with Ivan is a lot of times we think it's going to be a Passover. It's going to be, we're not going to have to worry about it. Tomorrow morning, we're going to wake up, there's a few rain, a few branches on the streets, and that's it.
Yeah.
But then you're seeing planes tumbling over at that moment. What were you thinking?
Small propeller planes. Yeah. I mean, we definitely need to be prepared.
Yeah.
That was it. So that was my first thing. Like I was not as prepared as I thought we should have been.
Yeah.
And funny enough, I was very, very young when Gilbert happened. So just hearing like my parents and hearing like other relatives and friends speak about how bad Hurricane Gilbert was, not only here in the Caribbean, but like also in like South Florida and stuff like that. So I was like, we were not prepared for that. But lessons learned.
Yeah.
And again, this is a part of, why we do this and why we try to get that message out there, is just so that everyone can be prepared.
Yeah. I think the most scariest moment for me was I was staying at a friend's house, and I just remember like we were just seeking refuge over there because everybody kind of just wanted to hang out because we didn't think anything really was going to happen. I think for me, when I knew a storm was coming, was just how calm it was before that storm hit. I was like, yeah, this is a different type of silence that I've never heard before. And of course, our governor at the time came on the radio, and that's when he declared a state of emergency. And I was like, okay, this is real. Like, he's not going to get on a few hours before a storm and say that. And I think when I looked out the window, there was a little crack on one of the woods that was placed on a plywood that was placed on the window. And as I looked out during the real impact of the storm, I saw individuals running out of their house, and I was wondering why they were running out. I guess they must have heard a certain noise,
Yeah.
but that's when I saw the roof just lift up.
Yeah.
And this was
man.
a very nice design house, by the way, guys.
Wow.
This wasn't like poorly built, but to see that's when I think for the first time ever in my life I was scared. I was like, are we going to live through this?
Yeah.
That's when I started like, there's no way
Yeah.
that we're going to live through this, and I don't know what else I'm going to see. But yeah, the reason that we're giving these stories is not to scare anyone for hurricane season, because we're right in the middle of it. Is to make sure that you do take being prepared serious, because there are a lot of people that are still living in households that are saying, nothing's going to happen. Oh, we don't have to do that. We don't have to buy this. That we don't have to take care of your health or your medication needs or anything like that. You don't have to know where emergency shelters are. And with that being said, let's give some of the locations of your emergency centers, where they're going to be located across the island, but not only in Grand Cayman, but the sister islands also.
Thanks, Dane. I want to say before I mention the shelters that I think after Hurricane Ivan, the government has really put things in place to ensure that buildings are safer.
Oh, yeah.
I remember that all the Caribbean, all our eyes were on the Cayman Islands. Even though I was not here, I heard persons saying, boy, the Cayman is flat. It's completely covered, and we are hoping that we'll never have a repeat.
Yeah.
And if we do, I think we are in a better position.
Yeah.
So we encourage persons, if you think you may not be safe in your home, to go to an EMC, Emergency Medical Centers. And these centers, as we said, are located at mainly schools and civic centers. So we have the Prospect Primary School, the Clifton Hunter High School, East End Civic Center, Craddock Ebanks Civic Center, that's north side, and Sir John A. Cumber Primary School. Savannah Primary over the years has been one of the EMCs. However, this year, I think it will continue to be a shelter, but it will not be an EMC. For the first time, we are going to have an EMC in the middle of town at John Gray High School Gymnasium. So that is replacing Savannah Primary. And so we are encouraging persons, especially those who are in town, to, if you need to go to an EMC, you can go to the John Gray High School Gymnasium. And we have specialized persons at these shelters. We have physicians, various categories of nursing staff, public health nurses, midwives, and we have mental health support. So we are well staffed.
I love that. All right. So I think we answered this question already, Jace, but we're just to reestablish it for our new listeners. Will EMS respond during a hurricane? I think this is a very straightforward answer.
So it's a no, Dane. So, and again, just to reiterate, so it's not just EMS, right? So it's going to be no emergency services, because that's something that has been designated across all blue light entities, as we like to say, so police, fire, EMS, and the regiment.
Yeah.
So no emergency response during sustained winds of tropical storm force category.
Yeah, which is pretty reasonable, and obviously we would like to think it's layman terms, and we shouldn't be overthinking this one. Guys, I want to ask this an important question for those that have medication. I think this will go to the pharmacist. What medication should you have ready before a hurricane? What do you think is important to make sure you have, especially those that are taking medication? I think this one is directed to anyone that has prescriptions already or any urgent need for prescriptions.
Thank you, Dane. That's a good question. So we want to encourage the listening public, for those that are on chronic medications, for any healthcare reasons, to have a 2-week emergency supply. And this 2-week supply would be separate from your daily medications. It's to be kept in your emergency hurricane kit in a waterproof container or bag, and it's to be set aside and set apart and not used unless it's in the event of the hurricane. If you're relocating to a shelter or relocating to a family member's house, you take that item, that bag, with you, along with your passport, along with a medication list and any other essential items that you need. For immigration purposes, if we need to fly you out or if you need some type of care at the hospital, you need to walk with that medication list, your passport, and that 2-week supply of medication.
Absolutely. Yeah, it makes sense. Now, I want to ask this question, though. How can they order these medication if they're not able to come while they're preparing for a hurricane? Because a lot of the times when storms do threaten the island, sometimes it's very last minute. Like we've gotten a warning before for 48 hours.
Yes.
So how would they, is there a way that they can expedite medication, or they can have it, I'm pretty sure this doesn't happen, but delivered, or maybe they can do it online?
Right. So we do have ways. We have several ways in which you can order refills or hurricane supply through our WhatsApp or calling our pharmacy at 244-2715. But we encourage persons not to wait until a storm is named, not to wait until that 48-hour period,
Yeah.
but have this as a part of your hurricane plan from the start of the hurricane season. So now would be an opportune time for you to start planning, putting your kit together, and ensuring that you have that 2-week supply of your chronic medications.
I love that. All right. And what if my prescription, this is for any customer that's listening right now, what if my prescription is old or expired?
Right. So you would need to, at this time, get a new prescription from your physician. So if you have not taken any medication in 3 months, you will need a new prescription from your physician. If you do have active refills on file and you have been using them monthly, we will be able to give you that 2-week hurricane supply.
Yeah, and I think that goes along with the next question. Can I use storm medication after hurricane season ends?
Most definitely. So you're going to put that 2-week supply aside, but once the hurricane season is over, you're free to incorporate it and use those meds as a part of your supply once you're monitoring the expiry date.
And this one I think is extremely important, and I think you guys came up with all the right questions. It's something I wanted to ask. It's funny enough, I've seen this here. But guys, how should medication that need refrigeration, because we never think about this anymore, if it needs to be refrigerated, and of course we're going to lose light. That's the first thing to be impacted, right? How should that be taken care of during a power outage?
Yes, that's an excellent question. And we advise persons as a part of your hurricane kit, if you are on refrigerated items, have a cooler, have some ice packs, and then you can store those safely in that way. However, there's some medications that require refrigeration, such as your insulin and your eye drops, that once you've used it, it's okay to have them unrefrigerated for 28 days. So if you're on insulin and if you're on certain eye drops that require refrigeration, if the light goes out, it's okay to continue using those already opened items for 28 days without refrigeration.
Okay. And, I know that they're making coolers now that last for as long as 48 hours.
Yes.
That you can put medication inside there. So that's always good to think ahead. That's why we're doing interviews like this, right? All right. So why is it important to have your medical documents ready in the event of a storm? This goes without saying that is a very important thing. But let's break it down with some of the important reason why you need to have your documents ready just in case of a storm was to hit.
So, that's a good question, Dane. So even when urgent medical care is needed, we need to have the various different documents readily available for individuals, right? So if you have any pre-existing conditions, as Nurse Joanna mentioned earlier, whether that might be diabetes, you might be hypertensive, or you might have high blood pressure, those things need to be known so that during a storm itself, if for whatever reason you need medical care and attention, it is easier for the medical teams to actually understand potentially what's going on with you.
Yeah.
Not only that, but also your passport. Please ensure that your passport is up to date. If for whatever reason, I know we've drawn reference to Hurricane Ivan. If for whatever reason the island is severely impacted, one of the things that the government is going to want to do first is to alleviate some of the stress or burden of additional persons on island.
Yeah.
So this is where we have wonderful working relationships with the United States, with the UK, and some of our neighboring countries, where we might actually have to send persons overseas for a period of time. So we want to make sure that all your immigration documents, your passport, whether you have a visa, whether you have an ESTA, a waiver, those types of documents must be updated, just to ensure that if for whatever reason you have to leave Ireland, you can do so in the smoothest fashion possible.
Yeah, that makes sense, guys. What are the documents that we're talking about? Like, what is important to be taken with you to evacuate?
So definitely you would need your passport. Again, if you have in need of police waivers, you would need your police waiver. From a medical standpoint, one of the things that we always recommend, not just in hurricane season, but one of the things we recommend for persons to keep with them at all times is your vaccination records. So additionally, keep your vaccination records. One of the things that we're also stressing as well from a Health Services Authority standpoint is the patient portal. So we have an online app, an online platform that persons can access all of your medical information literally from the palm of your hand. So for those persons who do not have that, initially to set it up, you have to actually come into the institution.
Yeah.
So we normally ask them to make contact with persons out into the atrium. So that's the front part of the hospital. You speak with some of our patient experience team there, and they can help walk you through that step-by-step process. From that, then you're able to go away and access your patient portal pretty much remotely from wherever you need to in the world. So those would be some of the main items that you would need. So definitely, if you don't have the patient portal app, again, we encourage you to get that as soon as possible by coming into the organization, and our patient experience team can help you download that onto your phone. Additionally to that, if you don't have some type of electronic platform, your vaccination card, make sure you have your medical records with you, your passport information, any type of information that you might need if you have to leave the island.
Yeah, and listen, I actually have this portal. I've used it. We started using it, obviously during COVID-19 when we needed to travel. Obviously, it was something that we needed to present in order to travel and receive access to get into the United States. But it's a wonderful platform, and it actually does give you history on your medical, right? So it's something that you definitely, if you have not signed up for it, I will urge you once again to get that done. You do have to stop by HSA, but can you run through that once again just to let people know how they can get signed up for it?
So yeah, for persons who do not have the patient portal app, again, for your initial login, you have to come to the HSA. So you come to the main hospital, you go into the front of the hospital, which we refer to it as our atrium. There we have some patient experience staff that are literally at the front desk. Just ask them for some assistance. Let them know that you want to download the patient portal app. You want to have that on your phone, and they will work with you and walk you through the step-by-step process.
I love it. And let's take it back just a little bit. You're talking about government able to send off patients. You have working relationships with different medical centers across the world, the UK, United States. Is that at the cost of the patient, or is it the government that's paying for that, or the hospital?
So that would have to be a discussion for
insurance, right?
Insurance at the time, based on the situation itself. Hand on heart, we're not going to keep persons here to, I wouldn't say suffer, but go through unnecessary trial and tribulation, so to speak.
Yeah.
So where we can encourage persons to leave the island, that's what we're going to do. And again, as a part of our preparedness plan, as an example, so I have family in the States. So as a part of my hurricane preparedness plan, if something bad were to happen here, so my family would actually go and be with my family in the U.S. itself.
Yeah.
So again, that's some of the ways that we can help to prepare ourselves as well.
Yeah, think about stuff like that. Like one of the things, guys, that I am doing, I don't know if a lot of family members do that in their family, and I hope you do, and I hope this show kind of opens all of that up so you guys can learn from other people. Is we have meetings about hurricane season.
Yeah.
Like we're talking about like what do we do if a potential Category 5 hurricane was to approach and we have time to leave? We leave.
Yeah.
Right. Those are the things that I wouldn't put my family through or my kids. If I have to stay here for my job, then I would.
Yeah.
We talk medication also because obviously we have our mother-in-law that's living with us now, and she's always in need of medication.
Yep.
So we want to make sure that we're always prepared.
Yeah.
And just different things that we have to do in the house so we're not scrambling around and obviously doing things last minute. We know what to do, we know what to look for, and we know how to prepare. And even when we go to the supermarkets, we're now, and Foster's makes it very easy, shameless plug, but I think a lot of them are doing it. They put like a sticker on different areas to show this is a selected hurricane preparedness kit.
Correct.
Right? So you can grab those things, bring it home, because the one thing I hate to see, guys, and I see it all the time, is you wait till one day, 24 hours.
Last minute.
Before that storm hits, and then you wonder why things run out off the shelf. And I still don't understand the toilet tissue. I don't understand that. I don't get it. But it seems to be the most popular item during any emergency, even an earthquake. But but yes, more questions here than I think it's needed for any form of patience is what should pregnant women know about hurricane prep? If you are pregnant and you are unfortunately a storm was to threaten the island, how should you prepare?
So pregnant women, especially those in the third trimester, should be assessed by their OBGYN. So they should visit or speak with their OBGYN. And the doctor may recommend that they go to an EMC or they go to the hospital, especially if they think there may be some complication. What we encourage pregnant mothers to do even now is to have your hospital bag packed.
Yeah.
and your antenatal record, medication, anything that is vital to you and the baby. Have those things ready, because just in the event you may need to leave to the hospital or to an emergency medical center.
Yeah.
But speak with your OBGYN.
Yeah, and also, is this wrong to say that if if a storm was to threaten and you feel like you have like a couple of days left, should you automatically just check yourself into a hospital?
No.
No, it doesn't work that way.
It is important that you speak with your OBGYN.
Yeah.
Because the hospital would not have the capacity to accommodate so many persons.
Yeah, there it is. That makes sense. All right, we're going to come right back. We're going to take a short commercial break. And when we come back, we'll dig deep more into, of course, just asking about the needs of a pregnant lady or anybody that needs to seek refuge at a hospital. We'll get more deeper into that. All right. So this is the last segment. We always say, guys, if you have any additional questions, maybe things that we have not asked on the radio, I tend to do that a lot of the times. Don't be afraid to send it in. We'll go ahead and send it off to the marketing department, of course, of HSA, and they will get those questions answered to you. Keep it locked. We are Bobo 103.1 FM.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
All right, welcome back to the show. We are Bobo 103.1 FM, a show dedicated to all things HSA. We usually talk to a lot of the superheroes in the background, obviously in the medical field, doctors, nurses, maybe someone that works in the admin team, maybe there's a special event that's coming up. We talk all things, of course, HSA, and we always educate you on just breakthrough departments that are coming about that you guys don't know anything about. And we want to inform you and educate you so that way you're always in the know of what's taking place with one of our favorite hospitals here in the Cayman Islands, and that is HSA. The hospital is recently renamed to also, all right, guys? Keep me honest with that one, but I do think it's a new name now. It's no longer HSA, or is am I wrong? Am I wrong? Is it official yet? Has it been official?
It
I think it's
official.
Anthony Eden.
Yeah, sir.
Yeah, sir.
So Anthony Eden.
Yeah.
Health Services Authority.
Obviously, you guys haven't made all the changes in polo shirts and
not yet, because as you can imagine, the rebranding process can take quite a long time. But it has been rebranded at the main campus, and we're starting to rebrand some of the outlying areas. But yes, that is the new name.
Perfect. Wonderful. I knew that was a change, but I wasn't seeing a lot of the signage and polo shirts. But like you said, in marketing, because I did work in that department before, that does take time. So that does need a little bit of time in order for it to be rolled out. Guys, let's bring it right back. We were talking about emergency shelters. We did mention a lot of where the shelters will be located here in Grand Cayman, but I want to pay some special attention to our sister islands. Those locations and where they're located for our sister island guests that are listeners that are listening right now.
Thanks for that opportunity, Dane, to highlight that for the sister islands, we have one EMC on Cayman Brac, and that's Aston Rotty Medical Wing. And for Little Cayman, it's the Public Works building in Little Cayman. So I'm sure it's not hard to find, and just make your plans from now to be at those shelters. They are well equipped if you think you need to be at an EMC.
Mm-hmm. Yeah, perfect. And we mentioned Grand Cayman before. Can we do Grand Cayman again really quick?
Of course. So for Grand Cayman, Prospect Primary, John Gray High School, that's the gymnasium, Clifton Hunter High School, East End Civic Center, Craddock Ebanks, that's Northside Civic Center, and Sir John A. Cumber Primary School.
And just for the new listeners that came about, we were talking about emergency shelters and how you get registered to stay. Can you inform them again? And if they want to stay at an emergency center, how do they get registered?
So if you'd like to stay at the shelter, if you're mobile, that's fine. You can just identify the shelter close to you and you can go to that shelter. However, for persons who are homebound and you may need transportation to the shelter, then you can reach out to your nearest health center and speak with one of the nurses there. They will take your information. This will be communicated to the emergency medical services team, and transport will be arranged for you to go to the shelter.
Thank you so much. And I want to go back to, of course, the medication, recapping a few things here. Just want to go back to some medication needs here. So what medication should you have ready before a hurricane? I know we asked this question earlier, but for anybody that's just tuning in for the first time, that obviously are always in need of medication. This is something, unfortunately, they have to deal with on a weekly, bi-weekly, or a monthly basis. How should they prepare?
Yes, thanks, Dane.
Yeah.
So we encourage the listening public to have their preparation plan in place with their hurricane kit. And this should include an extra 2-week supply of medication that you keep in a waterproof container within your hurricane kit, and you don't use it unless needed in the event of a hurricane.
Thank you so much. And I know earlier, before we took a short commercial break, we were talking about, of course, the needs of any lady on the island that is pregnant. Now, what if a pregnant woman wants to is experiencing contraction during a storm? Now, we've talked about that emergency personnel and hospitals are closed down during an active storm, but I think this is a very good question to ask to any one of you guys on the show today. Like, what happens if you're about to give birth during an active storm? How do we deal with that?
Mm-hmm. So with that, Dean, if the ladies who may be pregnant, if they're feeling any of these symptoms, we encourage them to call 911 immediately. Our 911 dispatchers, they will put this in a call queue and in an order of priority. Now, as mentioned, if it is safe for the emergency medical services to respond, we will do so and we will respond to the person. However, if it is unsafe for us to respond, the 911 call takers, they are trained to actually perform field deliveries in the field. So they will be able to talk to the caller that's actually called 911 and guide them through the appropriate steps. Now, if someone has gone to one of our EMCs, our emergency medical centers, we have, as mentioned by Nurse Joanna there, we have several medical personnel in these shelters. Again, in our regular shelters, they're all staffed by Red Cross volunteers as well as persons from the Cayman Islands Regiment who are also trained to a basic CPR and first aid level. So if this is the situation during a storm, we do have mechanisms where we can at least assist in the process of field delivery. As an example, for the EMS staff members, this is something that we do as a part of our regular job at times. You know, sometimes baby just wants to make a grand entrance.
Yeah.
Can't make it to the hospital, so we're going to do it right in the back of the ambulance or maybe at home.
Yeah.
So this is something that we do on a regular basis as well.
All right. And obviously police are trained for that also?
So they will also be guided by our 911 dispatchers. So our 911 dispatchers, they have medical dispatch training. So they're able to guide whether it's lay persons or even basic CPR providers to perform additional tasks.
Yeah, there it is, man. So all these questions are necessary, guys, because I know it's stuff we haven't taught about during an active storm. And I'm glad that HSA have taught about all these questions and answer to a lot of these questions, because a lot of them I haven't even thought about for myself. One that's very, very, very important is, obviously, it's a word I think a lot of us do not like to hear, but any patient that have unfortunately had the hard time of hearing the word cancer, and they're going through their current treatment. Now, what happens there? How are we dealing with them during an active storm, especially when they have to go and be cared for and taken care of? And it's very important care that they need, right? So how do we go about making sure that they're taken care of?
Yes, so these are some of our precious patients. All our patients are precious, but these persons are very, very dear to us. So patients receiving cancer treatments will be contacted by the chemotherapy unit to coordinate their care before, during, and after the hurricane. And some persons may be encouraged to also go to the shelter based on their state, but the chemotherapy unit decides. So if you are out there and you are being cared for by the chemotherapy unit and you have not heard from your staff, you know how to get to the chemotherapy unit, because I know the relationship that is established there. So just reach out to one of the staff and they will advise you. And the same with dialysis. So the dialysis patients are usually dialyzed.
Yeah.
All patients are usually dialyzed before a storm. And they're also encouraged to ensure that the unit has copies of their passport, their visas, and other necessary medical records in the event that they may have to go overseas.
Yeah.
And some of them also are advised to relocate from where they are. And then after the hurricane, they are usually given priority because, they may be home like for 2 or 3 days. And also at the dialysis unit, there is someone there, even during the storm, in the event that there are any emergencies, there is someone at the unit to ensure that these persons are taken care of.
All right, really good feedback. And I think these are one of the patients that we were talking about that, if they're needed to travel overseas, these are one of the ones that we would look at partnering with, right?
Yes.
Okay, amazing. Good point, dear guys. So really good question here. We spoke about mental illness earlier, off the air and on the air. We were talking about how many people are still going through anxiety just because of the storm, or may just have their own mental illness that they're suffering with. But let's talk about nonviolent here, because obviously if it's a violent situation, that will be completely handled by a different area, right? We would think a police department would have that under control. But nonviolent patients with mental health concerns may be referred to an emergency center, right? That will happen. How do you guys deal with those challenges?
So, good question, Dane. So, like you mentioned, nonviolent patients who might be experiencing some type of mental health concern or crisis at the time, they would be encouraged to go to an emergency medical center. As mentioned by Nurse Joanna, every EMC has several different medical personnel there. So we have nurses, we have doctors, and we also have mental health professionals, whether it's clinical psychologists, whether it's our mental health nursing staff. We have in every single EMC. Now, we also have persons that are trained in mental health first aid that are located at every single shelter, but they are trained to a basic level. So they would have to probably call in to maybe one of the EMCs to say, listen, hey, we've identified this individual. These are the symptoms that they're currently exhibiting at this point in time. What are your thoughts? How can we best support them? How can we best help them?
Yeah.
But at the EMCs, they actually have clinical trained staff members there, as mentioned, and they're going to, take that person aside. They're going to have a good discussion with them, do a nice clinical evaluation to find out exactly what's happening, what's going to be the trigger that they're going through at this point in time, and they're going to work their way through that. I know sometimes everyone kind of goes towards the route of medication. That might be the case, but that's not always the case, right? There are times where we just need to simply distract that individual.
Yeah.
They're experiencing a trigger maybe because, hey, if they're in an EMC during a Category 4 storm, hey, that would kind of trigger many persons, right?
Yeah.
So you can imagine someone who has a bit of anxiety, a bit of uneasiness. So that's how they're going to be able to help treat those individuals.
All right, love that. And it's an important feedback to give also. It's fair to say that we say nonviolent, but we never know if somebody can become violent, especially going through a situation like this. Do you guys always station security or have somebody that's obviously stationed at those emergency centers?
That's a good question, Dane. So at every single shelter, we have members of the Royal Cayman Islands Police Service that are going to be there, along with the shelter managers.
Yeah.
So the shelter managers who are assigned to each individual shelter, they're the ones that are overall responsible, but they're then supported by the Royal Cayman Islands Police Service. A variety of different shelters may have a differing number of officers. So as an example, John Gray High School, they will have a number of, let's say, 15 or 20 police officers that are going to be statically positioned there so that, again, we can have, adequate presence there.
Yeah.
They will also have the assistance of the Cayman Islands Regiment. So we do have measures in place. If for whatever reason we may encounter someone who might be a bit violent, and it might not be someone who's going through a mental health crisis. It might be someone else, right?
Yeah.
So we do have those measures in place for that.
Yeah. Listen, stuff like that brings out the worst in people sometimes. So anything is possible. And those are the right questions to ask because we want to make sure that there are people there that are trained on how to handle situations like that. One of the things that I have still not yet gotten done, especially after our last conversation, Chase,
Come on,
was
come on, Dean. Come on,
I
Dean.
know-
We spoke about this.
I know I don't have a number in my house right now.
We spoke about this.
I do not have a number. I don't know what's wrong with me, but I need to get that done. I need to sort that out because listen, not only does it affect my Let's Eat and bento drivers, but it could affect me during a hurricane. So let's
Yeah.
talk about how important it is to have a number on your house.
Yeah, it's very important. And one of the things that we've identified recently is that while some individuals might actually have their number affixed to their residence might be actually set back off of the roadway. So it's kind of hard for us to see. So what we're asking persons to do is also affix a number, whether it's on maybe a tree out front. If you can maybe put like a small sign with your house number out front so that we can quickly identify that, hey, this is number 123 as an example, so that we can respond quickly. We're also asking for the signs themselves to be a bit reflective if they can, because again, at nighttime, CUC prices, some of the bills are up. At nighttime, especially, those lights are going to be off, right? So we're trying to save on electricity, but that might obscure our vision or our view of actually seeing what your house number is. So we're asking for it to be reflective so that, hey, if we're shining a light onto the house itself, it quickly pops out to us.
All smart things to consider for sure. But please do not be like me. Please get a number on your house, even on the outside of it if you can. And great point with the reflectors. Make sure you put something that's visible, especially during hurricane season. This is how we prepared, folks. Now, we did say it was very surprising for us that we did not lose a lot of individuals here on the island during the impact of the Hurricane Ivan when it hit us. But we did hear stories of individuals that were using generators and brought it into their house and unfortunately passed away because of things like this. So how, because like myself, I purchased a generator recently that I am hoping not to use. But hurricane season is here, and there may be an opportunity or a chance that I may have to use it, right? How do you properly use? What are some safety tips when considering using the generator in your household?
So some of the safety tips that, and again, this is information that is on our that is on the Cayman Prepared website, which is published through Hazard Management Cayman Islands. Again, this is information that is published by the Cayman Islands Fire and Rescue Service. So if someone is utilizing a generator, please ensure that that generator is in no way, shape, or form near or immediately by your house.
Yeah.
Because again, we have carbon monoxide that is emitted from that generator. Carbon monoxide, it can actually make its way into the residence. And unfortunately, as you mentioned, Dane, we had a few incidents after Hurricane Ivan where persons succumbed to carbon monoxide and they unfortunately, are no longer with us.
Yeah.
So generators are not supposed to be in or near the house. So we want to have it away from the house, but we want to have it affixed to a particular solid object. One of the reasons why persons are kind of fearful during Hurricane Ivan, as we know, some generators kind of went walkabout, right?
Yeah.
So persons would replace the generators with a lawnmower that's running, and all of a sudden you would wonder why the fan in your house is not working.
Yeah.
So we want to ensure that the generator is away from the house, like we said.
It's only funny because it's true.
Yeah. Wherever your generator is going to be, like say, for example, it's going to be on the left side of the house. Let's try to also put a carbon monoxide gas detector in that vicinity as well, so that it will be able to detect if there are any fumes or any gases actually making its way into the house.
Oh, wow.
If you're going to refuel your generator, please ensure that the generator is off. What the fire service have recommended is that your generator actually cool down, because the exhaust, the muffler on the generator can still be quite hot even when we just turn it off, right? So allow it to cool down for 30, 45 minutes. Then you can go ahead and refuel your generator. And the next point is, if you're going to be utilizing a generator, please ensure that you have a working fire extinguisher in or near, so that, again, if anything happens, you're able to extinguish a fire if one were to start.
Smart. Very smart. And this is why we ask all the questions, guys. And very important, too. Keep that in mind, because even small things, like I've watched people said, okay, well, my generator is outside. And it was indeed outside, but it was in the back porch where right against your sliding door.
Yeah, no.
Like I've seen people do that. So that sliding door is often used.
Correct.
That can creep in.
Correct.
Just like the mosquitoes, right? So just be very careful. That's why, it's, as Chase basically said before, it's important to know where to put this, but also at the same time how to keep it safe too, because that was an item that was very much stolen during the storm, Hurricane Ivan, after the Hurricane Ivan passage. A lot of people did report stolen generators. So thank you for bringing up that point. Last thing I want to end with before we wrap up the show, an hour has successfully passed and we had a wonderful conversation. And once again, guys, I do want to remind you that you have any further questions, we can pass those questions on to the marketing team so they get to the right sources, right? But let's talk about the blood bank and why the blood bank could be calling for your donation before a storm. Why is it important to use to consider that they may be calling you, especially if you're one of those that donate? What are they using the blood for? Why is it important for them to call before a storm hits? And I think that's going to go to anyone today that knows the answer to that question.
So one of the reasons why members of the blood bank will put out a call is that, again, we don't know what the storm will bring if we're impacted by a storm.
Yeah.
So they themselves would also want to be prepared. As an example, at the start of hurricane season, they kind of ramped up their communication to persons to say, listen, hey, we know you normally donate, every 3 months, but can you donate maybe every other month just so that we have adequate stock and adequate supply? Again, we're not sure what's going to happen. So if we have persons that might need urgent surgeries, so that we actually have adequate blood supplies on hand so that we're able to provide that level of care and treatment to the patients if we need to.
I love it. Guys, all of this was all provided today, I kid you not, by HSA. Such a wonderful conversation. But I always urge you to please reach out if you have any more questions. There may have been things that we missed. Are only human beings, right? And we try to cover as much things as possible. But I will say this though, Trace, I will admit this. First, it was you being a fireman because it's what you wanted to do, right? Yeah. That was your life goal. Yeah. Then all of a sudden, you saw something else and you're like, that looks prettier. Let me join that. Uh-huh. And now you're deputy chief over there.
The deputy EMS manager.
Yes, that's a big deal. That's a huge deal. Well deserved too, by the way, based off your character and what I've seen of you. But I think you got a career. I think the ladies would admit in PR also. I think you should be speaking for HSA. Oh. Yes. I really do think when things happen and they need a PR person to go and talk on behalf of the hospital or even places like the government, I think you do that well. I think that's probably your next step.
We try.
Yes.
Try, yeah.
Good job, man. Yeah. I love it. I think you make my job very much easy when you come in here. So I always look forward to having you guys here. And thank you so much, ladies, for also being here and educating us in your field and area. This is the part where we like to do a quick wrap up in each of your department, just of things that you would want individuals to know before we end the show.
Thanks, Dane. And once again, thank you for having us. On behalf of the pharmacy department, we just want to ensure the listening public and assure them, that HSA has adequate supply of medications. We have adequate supply. We'll have a team there during and after. Once we get the all clear, the pharmacy will be back open to serve the public's needs, so you can be assured that we have an adequate supply of medications. Preparation is key. Plan. Now is the time to have the conversation with your pharmacist. Now is the time to get your extra 2 weeks supply of medication. And our contact numbers are 244-2715 and 244-7542.
Love that, man. Natalie, how about you?
Yes. Thank you, Dane. Thanks for having us.
We love it. I love when you guys come.
Spending time here with you.
Yes.
Word of advice, if you plan to be at the emergency medical centers and you are homebound or you have a caregiver taking care of you, please, that caregiver needs to be at the center with you. If you're on medication, you need to take your medication with you because we don't routinely give medication at the centers. And you take your beddings, your pillows, blankets, food, water with you. Yes.
Very important things. Thank you so much for wrapping it up with that. And Chase, anything for you, for your squad and your team that people need to take on their advisement?
Yeah, so thank you, Dean, and thank you to the team here for allowing us to come on. So as was echoed, now is the time for us to prepare. From the EMS services, we just want to encourage everyone to stay safe during the hurricane season. Yeah. Please prepare. If you're going to need emergency transport, please reach out to the EMS department. So that's 949-8600. Yep. Just ask to be transferred to the EMS or the ambulance service department so that we can ensure that we allocate the appropriate person so we can transport you to the necessary emergency medical shelters. During a storm itself, I know some people might have some anxiety about it, but if we are unable to respond to you, please still call 911. You're going to be put in order of priority. Yeah. And as soon as we've been given the all clear, we will respond to you as quickly as we possibly can.
I love it, man. That is, of course, our discussion it felt like a very short one because it was just so intriguing. But we will air it again. This will be double time that we'll play this one. So we'll keep you updated on the new date that we will play it after this date. All right. Thank you so much. It's Bobo, 103.1 FM.